If you're one of the millions of Americans who have Obamacare, your healthcare costs are going to rise. Recent reports say that the cost of health insurance under the ACA is expected to rise an average of 22% next year. Now, this is according to information released by the Obama administration earlier yesterday. Now, this news comes not more than a couple of months after Aetna, the latest group to pull out of the healthcare exchanges, actually finished doing so. Now, not only did Aetna pull out of the healthcare exchanges, you also had Humana and United Health Group. Well, why did they pull out? Well, they claim we just couldn't make enough money. I mean, taking care of sick people. I mean, that's bankrupting us. Which actually isn't true. I did a report when this happened back in August, where they lost a couple $100 million in profit, but they still had over $600 million in profit, or roughly around that amount. They were still making a very, very healthy profit off of the healthcare exchanges, but they decided to leave anyway. So it really isn't about the profit. In fact, it was actually about the DOJ suing Aetna to prevent them from merging with Humana. Now, it would have been a multi-billion-dollar deal. But the State Department says, no, we're not going to have a healthcare monopoly on my watch. And look, I got to give them credit for trying to break them up or prevent them from merging, which is great. Now, of course, the fallout from that is that, hey, if you do that, and there were emails on this, if you do this, if the DOJ sues us, we're going to pull out of Obamacare. It's that simple. Now, of course, that's a disaster for anybody who has plans under both Humana and Aetna on the Obamacare exchanges. It means that those plans are gone. You're going to have to get new plans that might be more expensive. In some places, there are plans. There are only one. There's only one insurance carrier in some of these areas, thanks to the these companies no longer offering their plans on the exchanges. That doesn't mean you can't get another plan cheaper in some of the other areas, but there are places like Arizona, for example, that only have one company. Well, there's no competition. You're going to have higher prices. And so, look, that's what's going on with that. Now, with that said, it is pretty likely that your portion will not increase how much you pay personally for your premiums. And that's because of federal subsidies. Now, if you qualify for those subsidies, if you don't make too much, you're fine. You're going to have the subsidies will also increase to cover that increased price. But if you're not in that category, if you make too much to receive federal subsidies, well, you're going to see a 22 to 25% increase. Now, NPR did report, of course, that those subsidies will rise. Kevin Griffis, Assistant Secretary for Public Affairs, Department of Health and Human Services, says, "We think they will ultimately be surprised by the affordability of the premiums because the tax credits track with the increases in premiums." As I said, that helps those people, but there are also plenty of people who will definitely see an increase in their health insurance because they don't qualify for those subsidies. So that's not good for them. They are seeing a huge increase. And that's what we warned against. Now, here's the other thing, right? Even with the subsidies, the amount of the subsidies going up for people so they can help, afford these health insurance plans, this is essentially a Band-Aid. And also, that means that more taxpayer money, is going into the insurance corporations. Again, in my opinion, that is the fatal flaw of the ACA. It's what we have been warning against the whole time. You can't just stick a Band-Aid on a broken healthcare system. And look, it's less broken than it was before, but we introduced an entirely new system that is health insurance corporation centric. And that is the issue. I mean, look, when you're speaking about healthcare costs going up, yes, they are going up 22 to 25%. Even with that, under the ACA, healthcare costs have actually slowed since 2009. They would have gone up anyway. They're just going up at a slower rate. Now, does that make it a great plan? No. It makes it mediocre at best. And what the result of this is that you have some people who now will not be able to afford their premiums. And you have other people whose taxpayer money is now going into these increased subsidies, which will end up going into the health insurance executives' pockets. And it's not as if these health insurance companies, earlier I claimed that they pulled out because, they weren't making enough money. Well, it's not like they were hurting under the system. Companies like Aetna have made a killing. In fact, between April 1st of 2009 and August of this year, Aetna's share prices rose 525%. Jesus, man. Their losses, look, yes, they had losses, right? But as I explained earlier, they still had a gigantic profit. So one of the reasons that they can point to these losses is that there were more sick people that were enrolling than healthy people, or that they would have liked. Now, these insurance companies would like it if 0 sick people signed up and just would sit there and pay their premiums and them not having to pay anything out. Well, that's not how the world works. And besides, when Obamacare was opened up, a lot of sick people understandably signed up because, hey, this is our actual chance to get insurance. Wow, that's amazing. Well, you have a lot of sick people in America that didn't have access to this health insurance before. And that's actually one of the successes, I think, of the program, because I want more people covered. I want people to be able to get health care whenever they want. That's great. But to the health insurance companies, it's like, oh, shit. We have a lot more sick people, which means we have to pay out more. And that means less executive bonuses. And I'm not in favor of that. I want my executive bonus to be even larger. Because as I said, health insurance companies, their main motivation is to make as much profit as possible off people's health. That means you get more healthy people to sign up than you have sick people, and then you make a profit. And of course, they also try to find any way they can to cut out sick people, to deny them. And of course, under this law, they were unable to. In order to participate in the exchanges, they are unable to deny people based on a pre-existing condition, for example. But look, these problems illustrate the need for another type of reform, right? And I think that is single-payer healthcare. Now imagine to not have to cater to the concerns of a board of directors mainly focused on their bottom line. The CEO executive, or the CEO, who wants his executive compensation to be larger. To not have to worry about that guy, to not have to worry about your premiums that you pay going to them instead of going to actually your health. Imagine that. That's the kind of system that a single-payer system would bring in, where 100% of what you pay goes into your health, into your health care, instead of what it is now. And look, it's not to say that I'm not against the idea, or that I'm against the idea of, health insurance, right? Sure, as a concept, that's fine. And look, I don't even have problems with companies making profit. That's what they're supposed to do. That's what they're designed to do. And I think in my ideal system, there would still be insurance companies, but they would be optional. You would have a single-payer Medicare for all system. Everybody would have the same type of level, basic level coverage. And if you wanted something extra, you can pay the insurance company to cover that. That's the role of insurance companies. And look, this plan isn't perfect, right? Maybe it has some drawbacks. Maybe there's something that I don't know. But I'm in favor of a single-payer healthcare plan. Plain and simple. Now, profit-centered healthcare reform, as we've seen the past few years, has not worked very well. I mean, it has worked to an extent, and there are a lot of people that are now actually very satisfied with their health insurance. And that's great. Now we need to take the next step. Now that next step being a public option. This public option would allow people to buy into Medicare if they choose. And if not, they can stay with an insurance company. Now, I think that that's an eventual step towards a single-payer system, because once people buy into Medicare, once they're able to, and they can leave those health insurance companies behind, I think that's what most people are going to do. Let's be honest, because it's a more efficient healthcare system. Once again, you're not paying an executive bonuses through your premiums. It goes to you and your healthcare. But there's that. So the whole point, though, of this is that we could avoid this kind of system, these kinds of rate hikes due to political backlash in the case of Aetna, if we were to transfer to a single-payer healthcare system. You've got to get the insurance companies out of business of controlling the access to healthcare for people. Because when you create that kind of system that puts them and their profit at the center of everything, well, this is the result. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent, non-corporate media, go to our Patreon page and become a patron. Patreon.com/TYTNation.